My name is Jaisha Wren. I was born in New Orleans, Louisiana, but I grew up in Humboldt County, Northern California. I was raised by a single mother with a non-traditional approach to child rearing. Deeply influenced by the social movements of the 1960s, she believed in the importance of confronting issues of social and political injustice. Ever since I can remember, she has spoken to me openly and frequently about racial and sexual oppression, activism and social movements, economic inequality, and even female genital mutilation. As a child, these topics stuck in my mind, and as an adult, my consciousness of them motivated me to come to UCSC and pursue a degree in sociology. I joined GIIP in the winter of 2009 as a junior transfer student from College of the Redwoods. Although I wasn't a techie, I was really interested in learning about how information technology can be applied to social justice. I immediately wanted to get going on a project, but I didn't know where to start. I talked to GIIP's director, Paul Lubeck. He told me about one of GIIP's partners, the Institute of International Education, IIE, and their Leadership Development for Mobilizing Reproductive Health program, LDM. The LDM program is active in 2 African countries, Nigeria and Ethiopia. Paul suggested that I go to Ethiopia and work with LDM for the summer. I was really excited at the prospect of such an amazing experience. The project would give me the opportunity to learn more about the strategies Ethiopians are employing to promote gender equality and eradicate gender-based violence, while at the same time allow me to support their work by sharing my skills in information technology. When I arrived in Ethiopia's capital, Addis Ababa, I was happy to find that people were kind and polite. The director and staff at IIE's Ethiopia office welcomed me with amazing warmth and introduced me to the LDM program and the Ethiopian community organizations in the network. I was connected to a smaller subgroup of organizations focusing on the reproductive health of youth. These organizations were located all over the country. Many of them had head offices in Addis Ababa, but some did not. My goal was to reach them all, offering useful and relevant trainings in information technology. I began by meeting with these organizations to learn about the work they do, the challenges they face, how they are currently using technology, and how they see technology further empowering their work. I was continually amazed by the people I met working in these communities. I saw their strength, dedication, compassion, patience, and creativity. I learned about their methods of responding to each problem, whether it be high rates of maternal mortality, prevalence of female genital surgeries or mutilation, or the increase in HIV/AIDS among youth, with a multitude of strategic responses involving as many stakeholders and community members as possible. I witnessed the strategic collaboration when I worked with Tashomi Senyi and ICETA, the Integrated Community Education Association. ICETA convinced the police department in the Oromia region they work in to establish the first office for the affairs of women and children and to appoint female officers to handle the cases. As part of my work with ICETA, I developed a database and trained officers on its use to help them efficiently collect, track, and report data. All the organizations expressed a need for databases and for a web presence to help them raise awareness about reproductive health in their communities, strengthen their organizations, and connect with domestic and international networks. In response to these needs, I designed workshops on blogging with WordPress and databases with Microsoft Access. I held these workshops in the city and then spent a couple weeks traveling around the country bringing the workshops to organizations in more rural regions like Bahir Dar, Mekelle, and Lalibela. What touches me most about my experience is that these people shared with me much more than their methods for affecting social change. They involved me in an intimate part of their cultural identities and communities by sharing their work on issues of sexuality and the power dynamics of gender. The experience left me more aware of the importance of transnational collaboration and reinforced my understanding that we struggle together, that the problems of patriarchy and gender-based violence are global.
Bena bunya ba lemu bunya benye fa ba ka sise ya o